thank you everybody for joining us. For the Encore presentation of David Covell, who has new and updated information about COVID-19 and the vaccine. And there will be a chance for questions and answers after his presentation. If you have a question, please feel free to type it in the chat and at any time, and we'll start from the top and get as many of your questions answered as we can. Hello, my name is Mark Beppel. I'm president of the Power of More. The Power of More is a consortium of 9 different chambers of commerce, all working together to extend the reach of their members to grow their businesses. I'd like to bring everybody's attention to our website, which is powerofmore.org. The next event that we have coming up will be a virtual event on January 7th with featuring Cindy from NOAC. She has a whole bunch of different cost-saving measures for your businesses, from healthcare to telephone to all kinds of good stuff. I would like to take this time to introduce John Soboleski, the founder and chairman of the board of the Power of More.
And now, ladies and gentlemen, here's Johnny.
Thank you, Mark. And ladies and gentlemen, let's give Mark a thumbs up for, again, setting up the Zoom meeting.
Thank you.
Thank you, Mark. We appreciate it. And special shout out, David, we so appreciate you doing this, your expertise. This is the Encore presentation, and we thank you so much. And to everybody else, Merry Christmas. Hey, we're almost through this thing. Well, we got the ball on the 1 yard line, and let's get through it. Speaking of balls on the 1 yard line, congratulations with all sincerity. Cleveland Browns, 9-3, is that what they are? Or? But with all sincerity, I actually wish they would have won, because this town would be going crazy right now. You wouldn't even know there was a COVID. You know what I mean? It would be going crazy. So keep your fingers crossed. I hope they lose the last game of the season and do well from there on. All right, Merry Christmas, everybody. Ladies and gentlemen, I'm going to turn this over to David.
Thanks there, John. And, John invites, John and I hang out together occasionally, even though he is a Pittsburgh fan and I'm a lifelong Browns fan, and I forgive him. That's an important part of life. You got to forgive the issues that your friends might have. So, okay. So I want to do just about a 5-minute update on what's been going on, and then we can kind of talk through questions and answers. So ironically, I was on a Zoom call, I think yesterday or the day before, and someone said they were talking to one of my colleagues, and he seemed happier than normal. And his response was, local health departments have been on defense. We've been on defense for a while because we're doing case contact tracing and trying to slow this thing down, and we're about to go on offense. Vaccine is what we know. We know how to get it out into the community, and we are really excited about putting an end to this thing. And so that's a really good thing. And when it got more real, we found out how many doses we're going to be getting and when and all that kind of stuff. That my staff, who was just run down from this whole year, and I know we all have put up with a lot, my staff all of a sudden felt electric again, that, we're really ready for this thing to be over. And so I want to talk a little bit about that. So one piece, let's talk a little bit about, not the greatest news yet. And that is, I talked last time on this call about the case count and the wave that we were in, and that it was still pretty bad. And if you remember, I talked about weeks ago, we had 150 a week in Lorain County. We thought that was a huge number. The next week it went to 300, the next week 500, the next week 1,000, the next week 1,200, the next week 1,500. And then 2 weeks ago, it came down to 1,436. And last week, now it was 1,300. Now, again, it's coming down, but that's not exactly where I want to stay. So we still got a little ways to go before this thing's over. And so although I'm going to talk about a lot of really cool, encouraging news that's coming, I want to make sure we're clear that we still got to get through Christmas, and we got those terrible January, February, March months that are cold. And so, you know, for those of you, especially in the restaurant industry, who I deal with quite a bit, I know it's been rough. And so I just want to help you plan for what this is going to look like and when we're going to really get more and more back to normal. And so that way it can help you a little bit with your businesses. So, okay, so let's move on to some good news. So as you know, Pfizer was approved, and many of the hospital systems in this area have been vaccinating people every day since then. And so that will continue. I'm going to talk a little bit about phase 1A, who are those people, and then how does that open up over time? But probably today or tomorrow or in the next few days, Moderna will be approved officially. They've been reviewing their data for a while, and it's almost the exact same vaccine as the Pfizer, and it's had virtually the same results. And so my suggestion is that is going to happen, and it's going to happen, you know, today and tomorrow and the next day, between the advisory panel and the FDA making it official. So that's good. Those are two vaccines that are coming. So we are scheduled to get vaccine here at the health district. We're going to get 500 doses on next Tuesday. That's the plan. And so we will begin EMS vaccination the next day on Wednesday. So I want to talk a little bit about phase 1A and what does that really mean? And so phase 1A are healthcare workers, right? These people who've been working in that COVID wing, and the hospitals will triage these folks. It'll be people in the COVID wing in ICU first, and then it'll be people who are just working in the hospital in general on patient care. And it'll kind of go from there. And so each of the hospitals has their system to do that. They're mostly using Pfizer. They may use some Moderna. The reason why hospitals and the pharmaceutical companies the pharmacies are going to use Pfizer is it has to be super cold. And frankly, it's just hard to do that with mass vaccination. And local health departments really don't do that often. So they already have the capacity. So Pfizer is going to be used mostly in the setting of the medical scenario. Or Walgreens and CVS, along with a couple other national chains, have been tasked to help long-term care facilities. So they're also in 1A. So you can imagine workers in long-term care and long-term care residents. Remember, when it gets into a nursing home is when we have our deaths, right? This is when it really causes a problem. So the quicker we can get them protected, the less it matters if someone a little younger gets it, because then they can't spread it into those higher risk populations. So the more we can protect them, the better, and as quick as we possibly can. So that's happening here. Matter of fact, I know for sure in Lorain County, but I'm sure all over the region, they're already scheduling long-term care vaccination going on. So I know of some already that are going on. So that's all happening right now. That's going to be both Pfizer and Moderna, but mostly Pfizer. And then we will be handling EMS. We'll be handling group homes, for DD, so group high-risk group homes like that. And then, private healthcare providers that go into the home and do home visiting, for older adults and folks like that. So that's that first tier, the tier 1A is going to get handled. And so as that rolls out, we will have, my suggestion is that whole group will at least have their first vaccine by the end of January. And in our case, we will vaccinate every EMS worker in this county will be vaccinated both times by the end of January. Okay, now again, it's vaccine dependent, so it depends on how many vaccines we get, but most likely that's going to happen. Matter of fact, once we hit the Wednesday, we will give them a card that says, come on back 29 days later, and they're going to come back. Okay, and I would say healthcare workers are going to get in the same boat, whereas it's all going to be vaccine dependent. As it rolls out, we'll keep moving it. So that's a good thing. Now, if you think about 1B, so this is going to be other folks like police and fire. I'm not someone who's in 1A, in case you were wondering. My nurse is, who goes out and actually, works on people. Those people are 1A, but other people in my department that work in an office, you know, I don't do anything. Everybody does all the work. I just sit back here and take the credit. But anyway, so, but honestly, you know, folks like me are not going to be a 1A. We're going to be a later phase because again, I don't have direct medical care on in folks. And so police and fire will be after the EMS. Okay, and so will teachers, other essential workers. There's going to be a lot of discussion around what's an essential worker. There's been some discussion around people who work in the restaurant industry because they come in contact with people a lot. And then that turned into, well, is it the person who bags your groceries? Is it the person who works at the counter? So there'll be a lot of, you know, discussion around that. And while vaccine's short, that'll just get rolled out one wave at a time, and that's how that's going to work. So in business settings, in some cases, what we're going to do here in Lorain County is as a business is identified as a 1B, if you will, and we're going to need to go out, we'll go out to that facility and vaccinate people if they have enough. Now, if you have 9 people that work for you, we're going to probably ask you to come to us. But if we can do something called a closed pod. Pod is a point of distribution. And so pod systems are what we've designed years ago to vaccinate the whole community. And so when we have an open pod, that's kind of like a flu clinic where people just come in and get vaccinated, So a lot of that'll be going on. I'm going to give you a time frame of when that's going to happen. But we also are going to do closed pods where I only have people from that business, or maybe just the sheriff's office, or maybe just, yeah, again, like we're going to do for EMS. We'll have all the EMS are going to come at one day on Wednesday and get vaccinated. So those are the kind of systems that we're going to be using to vaccinate people. Just so you know, you'll hear more about this over the next few weeks when it's your turn. And so as you hear that, you'll have questions, I'm sure, but there'll be lots of answers in the community for you. Okay. So when does all this happen? So there is a target to vaccinate everybody in phase 1. That's 1A, 1B, and 1C. That is everybody over the age of 65 with underlying health conditions, everybody who is, again, police, fire, you know, EMS, and of course this 1A group that I've just got done talking about, which is all the medical folks. So that whole group, which is almost 100 million Americans, is targeted to be done by April. So we think that's going to happen. Pfizer made a claim that they can produce 1 billion vaccines by April. 1 billion. That's not including Moderna or anybody else who gets approved. So again, I think we'll have plenty of it. I think it's just a matter of it's going to roll out one wave at a time. And so throughout January, you're going to see a lot of people getting vaccinated. So there's also been some, and then, okay, so now we take care of the sensitive populations, these, you know, essential folks, all that kind of piece, and we do a lot of protection. Then we fling the doors open, and now we say, anybody who wants a vaccine, come on down. And we start vaccinating in a mass scale. And we have a system to do that here in Lorain County. And I know that I used to work at Cuyahoga County, so I know they have a system to do that. So all of the health districts have got systems to do this. We'll also have community partners like drugstores and, you know, the giant eagles of the world. One of the concerns right now, and why it's a good thing that we actually have a limited supply right now, is that Pfizer and Moderna have a 2-dose scenario. So if I give you a vaccine, you got to come back to me and get that other one, because you can't, if you have Pfizer, you're not supposed to get Moderna, and vice versa, right? So we got to give you a card and say, come back on this date, and then you come back and get your second dose. So eventually, maybe, you know, we can all hold out hope. And not that I have stock in Johnson & Johnson, but Johnson & Johnson has a single-dose vaccine. We don't know the effectiveness yet. We won't know anything. We won't know enough about it until January. I'm sorry, until late January, early February. And that's when they're going to go for approval. If they get approved, then come April, when we say, come on down and get your vaccine, we can only do a single vaccine, and it's refrigerator temperature. And it makes life so much easier on us as a health district and on the general public, because you don't have to worry about what else you got. You can just get that one and you're done. So anyway, so that's that. There's lots more to discuss on that. You know, come the end of January, we'll have lots more information around that, but we're not quite there yet. In the meantime, we should have plenty of doses of Pfizer and Moderna to get all of these sensitive groups, this phase 1 and phase 2 groups, done. So that's the plan. That's the tentative time frame. So just as a business, and I know, again, some friends of mine work very closely in the food business, you still got to make it through December and through January, February, and March when it's cold and you can't eat outside and you can't do all those other things that make it easier. You still got to struggle a little bit here. And I'd like to give you all rosy news, but I got to be frank with you. That's the way it's got to be. It's going to be a few more months before we can open up. Now, spring is going to spring, and it's going to be incredibly different than every spring that we've ever had. It's going to be not only good weather, but it's also going to be more and more vaccine in the community and more protection so that people can get back more to normal. My time frame on April to June is the target. Maybe it drifts into the summer a little, but my suggestion is by June-ish, this is going to be gone. And so for the most part, again, there's still going to be the occasional case. There's going to be some people that say, oh, no, I'm not getting vaccinated. And then they come down with it. There's going to be some of that. But once you get enough herd immunity, you're going to get, it's not going to spread around much. And especially when you get all the more highly sensitive folks vaccinated, then they're protected. So even if little Johnny gets it, or my 24-year-old decides to go out partying down in the flats and picks it up, I don't worry about him coming back to my mom because my 89-year-old mother, because my 89-year-old mother is protected now. So again, it'll start to get back to normal. That's the time frame. Those time frames will get clearer and clearer as time goes on, but I just wanted to make sure you got a kind of a preliminary look of what we're talking about. So with that, I'm sure there's lots of different questions. I do want to say this. There's just a lot of garbage out there on the internet. You know this, right? You've seen it in the news. You've seen it on the internet. So a couple things. Messenger RNA vaccine, which is what Pfizer and Moderna is, does not cause you to alter your DNA. That's just not true. It's just not. It produces a protein. So remember how the pictures of this coronavirus since the beginning has had these little spikes on it? Those are proteins, and that allows it to attach to your cell, and that's how it spreads. This produces a protein that gets your T cells, your immune system, to kill that identify that, and go and kill that virus. And so that's really all it's doing, is producing that protein. So it's not affecting your DNA. I heard other things like Google is trying to, insert some kind of tracking device in you and, through the vaccine. Come on now. I mean, seriously, my suggestion to you is this. If you hear something outrageous, it's probably not true. I think that's a pretty reasonable thing to say. And I know during these times, we don't always get that, but I want you to at least hear that's just nonsense. So, and the other thing is, I know, unfortunately, it was named Operation Warp Speed. Probably not the best name when you're trying to instill confidence in people. The warp speed part was a really smart idea. They prepaid for a lot of the vaccines so that the companies wouldn't have to take the risk. And so that made multiple companies say, okay, we'll take the risk and we'll try to get a vaccine that works. And so that was the key. And this messenger RNA that's in Pfizer and Moderna, the way that they do this vaccine, they've been working on it for over a decade. This isn't something brand new. It was just, could you get the coronavirus to be assaulted, if you will, or attacked by this vaccine? And that was the part they didn't know. But again, they took kind of that, the federal government took that risk out and said, you know what, if 20 of them don't work, we'll just throw them in the garbage. And it won't cost the companies anything. And that's really when they said, oh, that's why you had so many companies really racing, if you will, towards the vaccine. So that speed piece is not an issue. There's only one part of the speed piece that matters. And that is usually when you do a trial of 40,000 people, which is what they had in these trials. By the way, that's more than have been in other trials of other vaccines that have been approved. That's more people than have been used in those other trials. But usually that trial lasts 3 years. Right. And so you get longer term effects and things like that. And so that's why when they approve them, they're saying they're still going to monitor people for the next few months to make sure that once a lot of people get it, we don't have any kind of issue. So and so far, they're again, it's the effects are mild, just like a flu shot where you might get sore at your arm, or you feel a little down because your body's starting to produce the immune response we're looking for, just like people get with the flu. and that'll last, sometimes a few hours or even a day or so. But again, those are pretty normal for any kind of vaccine. So there hasn't been anything dramatic other than that. I guess with that, I'll open it up and we can start doing some questions and answers.
Awesome. Thank you, David. As a fabulous presentation as always, direct and to the point. I want to, we have a business organization, and I want to compliment the businesses in general and the businesses of the Power of More in specific. I've been in and out of our members' businesses, whether they be restaurants or offices, and it's amazing how people are adhering to the social distancing protocols, taking temperatures, disinfecting pens, cleaning surfaces. If you don't have a face mask, they have one for you. It's just the whole community is pulled together, and it's just been amazing. So I'd like to invite the participants here to put your questions in the chat to Mark Bethel. That you can find the chat at the bottom. It's a little cartoon type box that says chat. Feel free to submit your questions. With David, as far as the vaccine is concerned, the once you're vaccinated, you're not only you can't catch you can't catch the virus, but that also means that you can't be contagious anymore either. Is that right?
Yeah, so usually that's the case. They don't have evidence for sure on this yet, but it's usually the case with other vaccines and especially vaccines that are similar to this to coronaviruses. But they're not positive of that. And so what's going to happen, and this goes to the mask conversation. People are talking about, we're going to wear masks for years. That's not going to be happening. I'm just telling you now. And so, but we do want to, while we're rolling the vaccine out for the first few months, even if you get vaccinated, we're going to want you to still wear a mask and stay distant for a little while until more people get vaccinated, because they're not positive you couldn't be infected by it and give it to someone, even though you're not going to get sick or catch the disease. They're not positive about that yet. And again, that has to do with they haven't looked at it long enough. I think we'll find that out in the first month or so. But in the meantime, we are going to ask people to try to stay apart until we get enough people vaccinated. So for the first few months, again, January, February, March, and April, into April, we're going to be saying, hey, hang on. Still want to wear your mask, still want to stay separate, still want to take those precautions until we get enough people vaccinated. And so that'll be the ask. It's not going to be to the end of the year. It's not going to, it'll be sometime in that time frame of January through June that we'll have plenty of people vaccinated at that point. But I can't give you an exact time frame yet. But that's why they will still say, we're not positive about that, so please keep the precautions just for a little bit longer.
That makes sense. What metric is the government going to be looking at to say, okay, we're business as usual, back to normal, COVID's over, and how do you think that will be announced?
So what metric will the government use? So I will say this, the health commissioners meet with the governor every Monday morning, all 113 of us, and we talk about a lot of things. And the governor struggles between how does he help the economy stay alive, at the same time help people stay alive, right? And so he wrestles with it all the time. So I think there'll be a point where there's enough people vaccinated in the high risk community that those folks that will begin to soften up a little bit, and then as we get more and more of the mass vaccination done, then I think it'll open up even further. I don't know exactly what metrics we'll use for that. My suggestion is the case count will continue to plummet as we vaccinate people, and the reason is because there'll be more and more people that are immune. And so we'll get less and less and less and less of cases. And so I don't know where the magic number will be, but my suggestion is it's going to be sometime in the spring and summer. I just don't know exactly when it's going to look like yet.
Well, that's awesome. Thank you. We're planning a mask burning party when you tell us we can. We hope you'll join us. It was Nan Baker's idea. Thank you, Nan. All right. What is the process for getting the vaccine distributed and administered to nursing homes? And will the National Guard be called in to assist with this?
Yeah, so a couple things. The nursing home piece is being handled by both Walgreens and CVS. They each have 100 nursing homes in our region. And so they're doing it case by case, and they're doing it kind of like they did with the flu shots. They're going to come in with a little team. They're going to go in, they're going to vaccinate everybody in the place. And when it comes to group homes, that's going to be us. Local health departments are going to have, I have a team of a nurse and an admin person and a nurse, depending on how many people we have, we might have two or whatever that looks like. And they're going to go out to group home by group home by group home. So that's how that's going to happen here in Lorain County. It'll be similar throughout the region. And again, National Guard, I don't know what they're going to be, if they're going to be used for that. I would suggest that they have a lot more value at the mass clinics that'll be coming than necessarily these individual small ones, but I don't really know that for sure, how they might use them. And again, the National Guard has been re-upped for about 3 or 4 more months by the governor so that they're available for more of this. But again, we've already designed in our community since 2001, since 9/11, we've been planning for these kind of things, these bioterrorism type scenarios. So we've been ready for this. And so our local police and fire and sheriffs, they are all in. And I just met with the police chiefs in Lorain County this morning, and they're ready. And so again, I think we're going to be okay around that. But where the National Guard can be utilized, I think we'll pick up the phone and use them.
Thank you. Is there a cost to the vaccine, whether you have health insurance, don't have health insurance? They're just going to vaccinate everybody.
Okay. Well, this has been a little problem that us as local health departments are not completely thrilled about. We expressed our completely not thrilled about with the governor on Monday morning, a little bit maybe too aggressive with the governor, but he's been really great about, gracious about, listening to our complaints a little. We in Lorain County won't be charging anybody anything. And so if you come, anybody who's vaccinated, we are not going to charge them. But what has happened at the federal level, there's been some discussion that hospitals or drugstores could charge an admin fee to give you the vaccine, to recoup their cost of their nurse or their pharmacist giving you the vaccine. That's not going to happen for long-term care facilities, and it's not happening inside the hospitals, and it's not going to happen for tier 1 for us or anything like that. But, that's going to be a problem for mass vaccination. And we've expressed that. And the governor has said, don't even think about that, in terms of local health departments. They'll provide funding to make sure that our nurses are, I can provide enough nurses to get out there and vaccinate people. So we won't be doing that. And I doubt that public health is going to be doing that at all. But if you go to Giant Eagle and at some point when it opens up to that point, then they may charge you an admin fee. The vaccine will all be free. That's all paid for by the federal government.
Okay, so the health department, hospitals are free. You go to Giant Eagle, you may have to pay an admin fee.
Yeah, and I don't know down the road when the hospitals are not just dealing with their own people, but they're looking at, I don't know, general people that come in their doctor's office. I don't know exactly what that plan's going to look like. So, but again, it'll be the admin fee only, but sometimes that's $20. And so for some folks, that doesn't matter, but for other folks that does. And so again, that won't be happening at the health district, but I don't know. We'll know more about that in the next month or so.
Very good. Next question coming in is, how long will the vaccine be effective?
Yeah, so one of so let me talk about that in 2 ways. One was the natural piece where we were talking about natural herd immunity, how long would it take for everybody to get it and how long could they, well, we've actually found that only, we're only guaranteed to be immune if you get it naturally for 90 days. And we've had a few, just recently here at Lorain County, we hadn't had anybody who had gotten it before, but just recently we've gotten a few who they got it back in March, and now it's they got it in November or December, and they came back positive again and started to have symptoms. And so we're a little concerned that that's a big issue. As far as the vaccine, that probably is not going to be an issue. Most likely that vaccine will be your whole life, but there may be a time down the road where you get a booster or something, not unlike the polio vaccine when it was first invented. Jonas Salk's vaccine was good, but then they had a better vaccine that came out a few years later that gave people a booster. But it will not be a seasonal scenario like seasonal flu. It does not mutate seasonally like the flu does. And so most likely that will not be the case. But will there be a booster 5 years from now? I'm not sure about that yet. I guess we'll find out. We'll follow the science and find out.
So you're saying if the person has the antibody, is it still necessary to get the vaccine?
I highly recommend you still get the vaccine because you don't have nearly as much as you get when you get vaccinated.
Okay.
And so my suggestion is yes, and it'll treat you, it'll be just like a booster, not unlike a tetanus shot that you get and then 5 years, then you cut your hand or whatever and you go back and get a booster shot. And that's kind of the same scenario. So I highly recommend you do it.
Can you address the palsy side effects?
Yeah, so there was a couple of cases of palsy that happened, but it was the same amount that would naturally occur, percentage-wise, and so they're not sure if it really had any effect. So it's unlikely that that's a side effect. It's more of a statistical, scenario. And so yeah, they've had some discussion and they're going to watch for that just to make sure. But at this point, it doesn't look like that's the case.
And anaphylactic shock is another one.
Yeah, they're always worried about that with any vaccine. But again, it really hasn't been a scenario where people are really worried, have really had a reaction too much. So far, so good. I will say, and I guarantee this will happen, you will hear all kinds of stuff on the internet that someone keeled over and died. And it won't necessarily have to be true for it to get out on the internet. So my suggestion is keep monitoring what CDC and FDA are saying around this, because there is a reporting ability for everybody who gets vaccinated to kind of track all that to make sure that there's no long-term issue or no other issue that pops up.
On a personal note from your host, I read several articles about anaphylactic shock out of Alaska, and the headline was very provocative. The beginning of the article was very scary, and the last paragraph of the article mentioned that both patients carried EpiPens because of severe allergies.
Right.
You have to read to the bottom of the article to find that out. But
well, you just described in a nutshell exactly the problem during this entire outbreak has been this misinformation, both in regular media and in social media. So do yourselves a favor, tune it out, listen to credible sources, and move forward. That's my suggestion.
Read the articles in the bottom up.
Right, maybe.
What is the, this is an important question. What is the recommendation for pregnant and nursing moms?
Yeah, so this is a tough one. There weren't enough people in the study to determine whether or not it was an issue with pregnant or nursing moms. There were a few that got pregnant during the study and it had no adverse effect. But the problem is there's not enough for statistical significance. So it doesn't look like it's a problem, but I think right now they're going to continue to recommend that if pregnant and nursing moms postpone getting vaccinated just because they don't know. And again, there wasn't a study done on it. And so if you haven't studied that group of people, it's hard to make a recommendation other than to say, press pause.
Very good, thank you. Any thoughts or guidance on self-testing kits?
Well, that's up to you. I've heard they're more accurate now, so that's a good thing. Here's what I've said since the beginning. If you've got symptoms of COVID, assume you have it and stay home. And so if it makes you feel better to have a test at home to verify it, have at it. But I don't want you spreading the flu either. So as far as I'm concerned, if you got the same symptoms, stay home. So I've heard that they are more accurate, and so if it really helps you and your family to say, hey, I've got this and I think it might be, and you just for the reason to say, hey, I might have this, and just to give your folks around you a warning to, hey, monitor their symptoms, then that's fine. I don't know that I would ever buy one, but that's because my opinion is if I became symptomatic, I'm kind of going to assume I have it. That's the way I feel. So.
Okay. I think you've answered this question one way. It's one of those internet things. The member asks, they've heard this is an annual vaccine. Is that correct?
No, it will not. It will not be an annual vaccine. Extremely unlikely that it'll be an annual vaccine because it just hasn't mutated very much during this year, and so it's unlikely that that'll happen. They've had every virus mutates a little bit, but they've not had anything that makes it that you'd have to get it again. Again, down the road, will there be a booster? There might be. It depends on, a few years down the road, they find out people aren't as immune and it starts coming back or something. There may be a booster, but it is unlikely that it will not be like a seasonal vaccine that you get like the flu. That will not be the same.
Okay. I know you speak with the governor every Monday. What is your feeling on the restrictions mandated that they during the first quarter of 2021? Will they still be able to stay open, or do you anticipate more closures?
I don't think we're going to be going more closures than where we are now. What I can't answer is how quickly do things let up a little. And so I think, so this is a very non-scientific thing, so I really regret even thinking about saying it on a recorded Zoom, but I'm going to say it anyway. Throughout the history of time, many of these worldwide diseases come in waves, and we don't exactly know why. The plague was really 6 plagues, and there's multiple viruses that have moved in these ways. So I don't know why. I don't have an explanation. My medical director talked to me about it for a while, and he said that there really hasn't been any real explanation for it. So anyway, so we've had 3 waves of this virus. We had it at the beginning, and then we had it in the summer, and then we had it again now. And it appears that we're coming down out of that wave. It appears. And hopefully we'll be vaccinated enough by the time the next one hits that we won't have an issue. So these are all conjecture. I don't know scientifically. Again, it's usually 6 to 8 weeks, and it's been 6 to 8 weeks, and here we go. We're starting to come down. So if we could just hang on and hold it together for a few more months until we get some folks vaccinated, I think we may not have another wave, or at least not a very bad one, because we'll have enough people protected. So, so my suggestion is, I don't think there's going to be much more as far as restrictions. When the 10 o'clock piece and some of the other things are let up, I don't know. I don't know what the answer is. I did put something, I don't know if you read it in cleveland.com. They were interviewing health commissioners on what we thought about restaurants. And I'll say it, I said it then, I'll say it here. Restaurants are not having a problem spreading it table to table, right? It's really 6 people who live in 6 different households, come to the restaurant, and they have dinner for 2 hours. Right. And then next thing you know, 4 of them get it. Right. One person was there, didn't realize they had it, accidentally spread it to their friends. Now, the question is, if you closed the restaurant, wouldn't they just go do that at one of the people's homes? And so it's really a personal activity. It's a personal issue, not the restaurant's issue. And so my suggestion is the way restaurants have handled themselves so far, at least most of them, it really hasn't caused a lot of spread inside the restaurant. And so that piece, I don't think is going to change all the way till this is done. When will we be able to get more people in the restaurant, have more, bars and, that kind of thing? I don't know exactly what that timing really looks like. I'm just suggesting to hang in there, because I think it's probably unlikely it'll be before the spring, before you open up again to a larger crowd. So I know that's hard to hear, but I'd rather be honest with restaurant owners, so you're prepared. So.
All right. Well, you answered about 3 or 4 questions altogether there. Just point blank, what is your recommendations? I know we're coming. I feel like we're coming down off this surge. What is your recommendation for family holiday gatherings this season?
So I said this around Thanksgiving, and we did have a little spike around Thanksgiving. We would have been going down a little earlier if it wasn't for the Thanksgiving little blip. But here's the thing. It's time. It's a year of sacrifice. We've been sacrificing all year long, and I know it's Christmas. I get it. But it's time to do a little bit less. Spend maybe some time on Zoom with your family, or do something else, and really have less, just the people in your house preferably. Maybe if you have one other family, your brother, your sister's family, or whatever, then try to separate a little bit, spend a little less time together. Again, try not to go too widespread, because that's how we've seen it spread. That's how it's been spreading. And so I know we want to sacrifice just a little bit this year so that people are around next year. And that's really the key. And so I do worry a little bit about Christmas, although here's what I would say with Christmas. If I go home to my mom's for Christmas, I'm going to behave better that if I go to a New Year's Eve party. So I'm more worried about New Year's Eve than I am about Christmas to some degree. So my suggestion is the more we can limit, the more we can do that now, the better off we'll be in the long run. So yeah, I would say try to take at least a deep breath and be a little less, get together with a little fewer people and travel a little less. That would be great.
Yeah, well put. Very good. We have another question from a medical staffing company with healthcare workers in various nursing home and group home facilities. And they're asking, what is the best way to get our field staff and administrative staff vaccinated?
So the field staff, the staff that are actually helping with clients should be able to be vaccinated through your long-term care facility that you're working with. If it turns out that you're kind of left out and you're not, you should, my first suggestion is contact CVS and Walgreens on what I think they already have a plan for that, but I think they're doing that plan through the long-term care facilities. If you're in a situation where you have people working in long-term care facilities or home health care workers, and you don't have anybody to turn to at the moment, contact your local health department. I know we have some home health care folks who don't work with any nursing homes, and they are coming with same with our EMS. They're coming to our EMS location to get vaccinated. So again, you can reach out to me personally, even if you're in a different county, and I'll connect the dots with you, or just reach out directly to that county if you're in wherever your main headquarters is.
You say local health department, that's structured by county in this state, isn't it?
Yeah, so it is, except, it's a long story. It started in the Spanish flu in 1918, believe it or not, the last pandemic, and they created local health departments. Well, there are some city departments. So I'll give you an example. Lorain and Elyria used to have their own, but now we all merged into one. So there's one in Lorain County. In Cuyahoga County, Cleveland has their own, and the rest are under Cuyahoga County. So there's two in Cuyahoga County, the city of Cleveland and the Cuyahoga County Board of Health. And when you look at other, again, Medina County is all inclusive. And so, but there are some, in some counties, they have a couple of departments instead of just one. But if you contact any of us, we'll connect you to the right one. We're not going to leave you hanging.
That's awesome. You guys have been great. Thank you, David. I know you're starting with our heroes and the front lines first responders and the elderly and the people with health risks. And it seems to be dropping off by age. Will kids under 16 eventually get vaccinated, or we're going to let the younger kids just move on?
Yeah, so they're actually doing some studies right now with kids under. The current vaccines are 16 and over, so they will not be vaccinated with this set. But there are doing some studies right now with younger kids, so it won't be long. Remember, kids under 16 usually have mild symptoms, and they're more of a spreader than they are an actual big problem. Rarely does a child unless they have an underlying condition, rarely does a child actually have trouble with it. So they are going to be pretty far down the road. They're going to be the last in line, if you will, at this point.
Okay. Awesome, very good. But one last question just came in. Is the age for the vaccine, I think this means in your A1 category, 65 or 70?
65 and over.
65 and over.
And it'll be underlying health condition will be first. So if you're 65 and over and have COPD, or you have some other scenario like that, you're going to be first, and then 65 and over is going to be the number moving forward.
Okay, awesome.
Not for any real medical reason, to be frank. It's just they had to pick a number, so that's what they picked, 65 and over.
Okay, very good. Well, David, I cannot tell you how much we appreciate you coming on and sharing your insight with us. I know you had planned on retiring this year before the pandemic hit, and just like taking one for the team, you put in that extra year just to make sure we're all safe, and we really appreciate your sacrifice and the time that you're spending making this all work. And we hope you'll come back again in the weeks to come, and we'll close off now. I ask our members to keep an eye on their emails.
Mark,
And our founder has a few closing thoughts for us.
I I was taking too long to type this. David, if you are you have the virus and the symptoms are bad, you're very sick. Too late to take the vaccine? I mean, could it help?
You don't want to take the vaccine while you're symptomatic. So you've got to wait.
Okay.
Yeah, at that point, you just let it run its course. And after a couple of weeks after your virus is gone, then you come out and get your vaccine. Then it's fine. As a matter of fact, there's some concern. They don't know for fact, but there's some concern that if you got it while you were really sick, it may really get your immune system moving so fast that it'll be worse for you. So it's probably better if you just wait. Go through it. If you have to go to the hospital, go to the hospital. There's a lot of good treatment for it now. So again, and then afterward, let a couple of weeks go by and then you can get vaccinated.
All right. And then I found an app. I get the New York Times online, and I don't know, Dave, if you're familiar with this, or maybe it's fake news, but it's the New York Times. There's an app. It's very, very simple. I sent it to Mark, and Mark, if you want to share with everybody, it's on your, it gives you put your age, your county, and it tells you where you stand if you're a healthcare worker for the vaccine. And I just think it's probably the most amazing app I've ever seen in my life. I can't remember, if I ate lunch yesterday and this thing's telling you, you're
when you're up. Yeah.
Yeah, when you're up.
Yeah. So two things with that. One, there is a slight change in each state. So some states may tweak you a little bit up or down. So this is going to be the national one based on the national guidance. So there may be slight different there. And then the other thing is, I'll tell you, a police officer asked me today, he said, hey, if you get done with these EMS folks and everybody, and you got extra vaccine, are you going to hold on to it, or are you going to start with the police next? And I said, we are not going to hold on to it. The moment we have extra vaccine to move into B, we're not waiting. There's no way we're waiting. And I don't think any health department's waiting. So so you may be faster than what it might say on the app. But yeah, that app is pretty accurate in terms of the federal guidelines in general of where you are. It's just based on vaccine availability and each state's ability to get that vaccine in people's arms. You may be faster than you even think.
Right. Mark, I sent you that app in a text. I didn't know if it's possible. You're a tech genius. I don't know if it's possible to get it to these people, but if anybody wants it, 90% of you have my email address or my text. It's pretty cool, and it only takes seconds.
I'll do a New York Times interactive.
Any preference on the apps, Dave? I'm sorry, on the vaccines.
Well, I'm happy that it's Moderna, so I don't have to keep it extra cold. No, they're almost identical. So, and Pfizer's 21 days apart, and Moderna's 28. So if you have an option to get either one, the day it happens, get it. I will say, when the day comes that Johnson & Johnson becomes a single dose, if it turns out to be close to as effective or equally effective, then of course you want to get the one dose, because then you don't have to get stuck twice. But again, we'll see. We'll cross that bridge when we come to it in February, early February.
Is Moderna the only one with the palsy?
So that's the other interesting thing. Both vaccines are almost identical. And so the fact that it didn't pop up in the other one and it did pop up in the one, and again, it was 2 cases. So statistically, you're a good chance that you're going to get that many cases in the general. So they're trying to analyze the stats on that. It doesn't look like that's an actual problem. It looks like they mentioned it because they have to mention it. And the FDA looked at it because they have to look at it. But then the media picked it up and made it like this is a big deal. And I'm not sure it is, actually. So.
All right. So summing it up, Marky said, we'll all be cured by the end of January. Don't wear masks and go have a wonderful time at Christmas. Is that what everybody heard? Raise your hand.
I sincerely hope not. So,
you wonder where fake news comes from.
It comes from John Sobolewski. I've known that for years. Okay, well, hey, thanks for having me, and I'm happy to join another time. So just let me know when that could be, and I'll join you again.
Hey, Dave, one more question before you go, if you don't mind.
Sure.
You mentioned just a little bit ago that it's not a good idea to take the vaccine if we may have the virus. Would you suggest us getting tested prior to taking it?
No, so it's only if you're symptomatic. So if you're in, like John mentioned, that you were kind of really sick right now, don't take it when you're really sick. If you're an asymptomatic carrier or, has something like that, you do not need to worry. So there's no need to get tested right before you get the vaccine. It's only if you're real sick, because that could actually, add on to your sickness. So that's really the only time you'd consider waiting.
Thank you, Dave.
Okay.
All right. Thank you, folks. Have a very safe and safe holiday season, and I wish you all a safe and prosperous new year.
Merry Christmas, everyone.
Bye.
Merry Christmas.